Hey, it's Dr. Trish Leigh. I'm back with another neurofeedback question and answer. Okay, so if I don't want to do neurofeedback, what are my other options in terms of treatment options for anxiety or ADHD? Well, if you've explored these other options, you know that you're basically limited to a pharmaceutical approach. So there's medications, you probably know Ritalin and those types of medications in that family for ADHD. It's a stimulant medication that basically stimulates your nervous system for the time that it's in there so that you can focus. What it does not do is actually change the underlying brain pattern for ADHD. That's proven by science. But what it does is it might take the edge off. Unfortunately, for many people, it gives them anxiety and it makes it difficult for people to eat and to sleep. Okay, so then there's also obviously prescription medications for anxiety, which basically dull the nervous system so you can't feel how anxious you are. Yet again, those medications do not change the underlying brain pattern. Another treatment that has been shown to actually change the way the brain performs, but much slower than neurofeedback, is cognitive behavioral therapy. And at Leigh Brain and Spine, we have a psychologist, Dr. Jeannie Steffen, who's on our team because we think that's an awesome approach. We also know that that can be hard for people to use cognitive behavioral techniques if their brain is really dysregulated. So the way I approach it is neurological regulation first. Then we have people use behavioral strategies to help reboot their brain and rewire it and really hardwire it in to the great pattern once we've actually shifted that brain pattern. But CBT is proven by science to create some nice changes. We think that we know anecdotally that it's stronger when neurofeedback is combined. So those are your other treatment options, pharmaceutical or more traditional therapies, as I call them, and depending upon what you're struggling with. ADHD could benefit possibly from an occupational therapist, an ADHD coach, a psychotherapist. Same thing with anxiety, and with other challenges, traditional therapies or medication tend to be the more traditional approaches, and neurofeedback actually gets to the root of the problem, which is the brain performance pattern, shifts it into the better mode, and we help you keep it there forever. Okay, I hope that answers your question, and remember, control your brain or it'll control you.